So what is atherosclerosis? Atherosclerosis is hardening and narrowing of your arteries. It can put blood flow at risk as the arteries become blocked. You might hear it as atherosclerosis or atherosclerotic cardiovascular disease. It's the usual cause of the heart attacks, strokes, and peripheral vascular disease, what altogether are called cardiovascular diseases. You might heard something similar, which is arteriosclerosis. So what is the difference between atherosclerosis and arteriosclerosis? Arteriosclerosis is a broader term, which arteries narrow and harden, leading to poor blood circulation. Atherosclerosis, in the other hand, refers to a buildup of fats, cholesterol, and other substances which forms a plaque in the arteries, which also restricts the blood circulation. Of course, this is a disease, so you can get diagnosed by these symptoms, but you might not have any symptoms of atherosclerosis until your arteries are nearly closed or blocked, or until you experience stroke or heart attack. Signs also depends on which artery of yours is blocked or narrowed. Firstly, we have the symptoms related to the coronary arteries, which are unusual heartbeat, pain on the upper body or angina, and shortness of breath. Secondly, there are symptoms related to the arteries that delivers blood to brain, which includes numbness in arms or legs, difficulty of speaking and understanding, drooping facial muscles, severe headache, paralysis, and sight problem. Next, we have symptoms related to arteries of arms, legs, and pelvis, legs aching when walking, and numbness. Last but not least, symptoms related to the arteries that delivers blood to kidneys, which are high blood pressure and kidney failure.
Okay, next. Besides aching, factors that increase the risk of atherosclerosis include high blood pressure, high cholesterol, diabetes, obesity, smoking and other tobacco use, lack of exercise, and unhealthy diet. Aterosklerosis is a slow, progressive disease that may begin as early as childhood. Although the exact cause is unknown, atherosclerosis may start with damage or injury to the inner layer of an artery. So we have made a model to show you guys about the disease. For a normal artery, each artery is a muscular tube lined by smooth tissue and has 3 layers. Atherosclerosis is characterized by vascular obstruction from the deposit of plaque. High serum lipid levels have been shown to be strongly related to the development of atherosclerosis. What is lipid? Lipids are composed of carbon, hydrogen, and oxygen. In some cases, contains phosphorus, nitrogen, sulfur, and other elements.
First, you can ask for chest X-ray to check for sign of heart failure. This will show if the syndrome of cardiac ventricular dysfunction, where the heart is unable to pump sufficiently to meet the body's blood flow requirements. Next, you can check by CT scan or magnetic resonance angiography, also known as MRA, or narrow arteries. You also can try EKG, a record of your heart electrical activity. An electrocardiogram is a painless, non-invasive way to help diagnose many common heart problems in people of all ages. By detecting if there are any heart problems, we can know if there is atherosclerosis in your bodies.
Aterosklerosis can be life-threatening, but treatment is available. Receiving treatment early can reduce the risk of severe complications. Treatment aims to slow or stop the development of plaques, prevent blood clots forming, and treat symptoms. There are three options of treatment. The first one is lifestyle changes, and the second one is medications, and the last one is surgery. Research shows that the following lifestyle choices might reduce the risk. The first one, we need to get enough sleep and avoid or quit smoking, get a regular exercises, and maintain healthy weight. By adopting these practices from early adulthood may help to prevent problems later in life. And the secondly is medication. A doctor will prescribe medication to suit an individual's needs, depending on their overall health and other conditions. Drugs known as statins help manage a person's cholesterol levels. Other medicines can lower blood pressure, reduce blood sugar, and prevent clots and inflammations. People should follow their doctor's instruction and not discontinue a drug without seeking medical advice. They should also follow a healthy lifestyle as well as use medicine. And the last one is surgery. Sometimes a person will need to ensure that blood in their arteries continues to flow effectively. The option of surgery we got using a stent to widen the blood vessels, bypass surgery to carry blood around the affected area, and the last surgery is surgery to remove plaque buildup, for example in the neck. This surgery option may help person with severe atherosclerosis to free from this pain.
Okay, the last one are effects of the atherosclerosis. There are so many of them. First of all, atherosclerosis affects blood pressure. Aterosclerosis increases the blood pressure, which adds force against the artery walls. Clogged arteries due to plaque can cause various diseases, including coronary heart disease, heart attack, and stroke. After that, coronary heart disease can lead to heart attack. The symptoms may include severe chest pain, which can be accompanied by shortness of breath, fatigue, cold sweat, vomiting, fainting, and even death. Last one, atherosclerosis can be blockage stroke. Symptoms can include sudden paralysis of one side of the limb, paralysis of the facial muscles, difficulty speaking, eating, and drinking, double vision, balance disorders, confusion, and difficulty understanding speech.